When NASA's spacecraft began sending back photos to Earth in the 1960s, researchers at the Jet Propulsion Laboratory wanted to improve what they were seeing.
We had to develop really a new software operating system, because there just weren't any available. And they led us to development of a whole library of programs that could do image manipulation, could compensate for calibration errors and compensate for losses that you get from the camera.
They invented a video imaging communication and retrieval software called VICAR. With upgrades over the years, VICAR became more accurate, allowing NASA to learn more about our solar system and creating a powerful tool with other potential uses.
That led both Bob Nathan and myself, who have always been interested in biomedical, to see if these methods could be used for medical work.
Gary F. Thompson has a strong family history of heart disease. A marathon runner for many years, Thompson entered a race to mark his 50th birthday. By mile 20, he was in trouble, a heart attack. Although Thompson had recently received a clean bill of health from his doctors, something was missed in his exams.
I began a quest and to try and find out what was out there that might be a better device to identify people at risk and help treat them as well.
Through a friend, he learned about VICAR now being used in a clinical trial at the University of Southern California's Keck School of Medicine. Without revealing any of his own history, Thompson took the test.
In 15 minutes, they told me I needed to see the doctor right away. I asked them why, and they said, well, you have serious evidence of heart disease and you need to see a physician right away.
The new device did what all the other tests had failed to do. Eventually, Thompson licensed the NASA technology and started a company, Medical Technologies International, or MTI. He worked with Seltzer and the Keck researchers to adopt the technology for diagnostic medical use.
The biomedical and the technical coming together in one package is what ultimately led to the development of this new technique.
The software, now part of MTI's ArterioVision test, takes ultrasound images of the first two layers of the carotid arteries and analyzes them. The results identify the risk for the major cause of heart attack and strokes, atherosclerosis. ArterioVision is safe and relatively inexpensive. It can distinguish between 256 different shades of gray and has the most accurate resolution available for this type of testing.
Without the technology that was developed at JPL in terms of image processing, the kind of accuracy and the kind of reproducibility that we get wouldn't be feasible.
ArterioVision received FDA clearance and is now in doctors' offices around the country. For patients at risk, it's ideal.
When you show them a picture of one of their arteries and how much plaque it's got in it, and tell them that if this process continues, that plaque is going to cause stroke or heart attack, I think you have a much greater influence on that individual, understanding their disease, following recommendations, and making changes in their life to improve their risk factors.
Today, NASA technology has new meaning for Gary F. Thompson.
I still have tremendous wonderment about what's going on in space, but I smile more often now when I look up there because I know what we're doing in space is helping us here on Earth.